Over the last 20 years, a profound change has taken place in the relationship between citizens and their governments. In the Western democracies, this change has fundamentally altered the role of government as the provider of social care and public welfare. Everywhere, it seems, governments are retreating from the provision of social services. This retreat has not been one without a fight. People have often reacted with anger and resistance when social programs that took generations to establish are dismantled. But the social needs that gave rise to these programs are still with us, and while the gap between rich and poor is increasing, help for the weakest and most needy of our citizens is on the decline. Record numbers remain homeless. Health services are being eliminated, and those struggling with disabilities are left without hope or help. The retreat of government from public services is often coupled with a policy of privatization. This approach is justified by the argument that private sector alternatives are more efficient and cost less. Over the last few decades, changes in the role of government, both in Canada and internationally, have pretty well destroyed the concept of the welfare state that we've been living with since the Second World War. But a new approach has arisen that affirms the role of the public sector, while at the same time relying on the spirit of innovation and entrepreneurship that come out of the application of cooperative models for the delivery of social services. This documentary takes a look at how social services directed and controlled by the people who need them and use them offers a real alternative to the welfare state on the one hand and the privatization of social care on the other. Pioneered in Italy, social co-ops are becoming the fastest growing sector in the co-op movement in the industrialized world. Like all cooperatives, a social co-op is owned and controlled by its members. What social co-ops have in common is a mandate to serve the community, in particular those who are vulnerable or marginalized from the mainstreams of community life. Today, 6,000 social co-ops employ 50,000 people and provide a broad range of services to the Italian public. Social co-ops account for 17% of Italy's expenditures on social services. In the city of Bologna, 85% of social services are delivered by social co-ops under contract to the city. Among Europe's most powerful examples of a social co-op is the drug recovery community of San Patrignano. Located in the hills overlooking the Adriatic coast, San Patrignano was established in 1976 as a place where addicts could overcome their drug dependence and rebuild their lives through a combination of peer support, communal living, and skills training. Today, over 2,000 recovering drug addicts live and work in San Patrignano. Carlo Bozzo is communications director for the community and is one of its many success stories.
Who works in a social corps put at the top of his aims the solidarity and the relationship with the other people. In this way, also the structure of the corps is different. It's different because the most important thing is to reach the mission, the goal of the corps, to give help to other people. And the products are important because they provide to reach this goal.
The community of San Patrignano is wholly self-sufficient, with most of its revenue earned from the sale of the products made by the residents. The training here is therapeutic and transformative. Products are of the highest quality and command high prices. Hand-printed wallpaper is sold at $80 a meter. The state-of-the-art printing plant is Italy's second largest and serves customers across Europe. Each worker at San Patrignano is associated with one of 60 workshops that produce the goods and services which earn revenue for the community. Workers are the members and owners of these enterprises. The co-op model promotes the highest level of commitment to the quality of these goods. It is also an indispensable part of the recovery process.
The significance of artisan training in San Patrignano is very important. And in the artisanal training, the people see the guys can do a lot of beautiful things, and it's very important. A drug addict needs to see that himself is able to do something with his creativity, with his responsibility, and with his dignity of human being.
For the doctors, there are 3 doctors living in the community, like me. We are all former drug addicts. I came here about 20 years ago and I started studying in this place, like me, the other 2 doctors. So if a patient, I call patients, but it's not the right word to define, see the doctor that 20 years ago was a former drug user, is a different relationship, is direct relationship. I don't consider the patient a patient. I consider him like me 20 years ago.
I think it's very important for the guest of San Patrignano to know that San Patrignano is a social coop. Because in this social coop there are a lot of people which have been a drug addict. These people who's been like you. And this kind of structure is a structure that born from some principles of solidarity, from the principle of the help to the other. This one is not an industry. San Patrignano is a social coop. It's a place where a lot of people together live, where a lot of people together, come si dice affronta la vita?
Overcome.
Where a lot of people overcome the troubles of the life. And this is the message that which San Patrignano offer to all the guests of the community.
Alberto Alberani has been a pioneer in the development of social co-ops for the disabled and is now political director for Italy's largest cooperative federation.
E che può essere una possibilità di terza via.
I believe that the social cooperative model represents a third way of delivering social services, as described by theoreticians like Anthony Giddens. Between public administration and private enterprise, there exists the alternative where people are protagonists and owners of the services they receive. It is increasingly difficult, however, for this to be realized today. But what is important is that with the co-op model, it can be done. It is possible.
È possibile.
CADII is Italy's largest social co-op, owned and operated by 500 health professionals, social workers, and adult educators. Established in the 1980s to care for seniors and the disabled, it also operates nursing homes and long-term care facilities.
The cooperatives are in a much better position to deliver services in the best possible way because in a way, they have selected the work that they do, and they also select how to do the work, not only the kind of work they do, but how to do it. And therefore, they will put in the work that they do. And we see very often this when we meet these people in cooperatives, they will put all the passion that they have, And in services, this is absolutely fundamental. Just an example, if you are in hospital, it's not only important that the physician will treat you correctly, but will also treat you humanely, in a human way. This is not always the case, with bureaucracy. But in general, instead, in the co-ops, this is an important aspect of how they deliver the services.
In the city of Ravenna, Il Cerchio is a consortium of 4 social co-ops that provides services to severely handicapped adults. In addition to a permanent residence facility, the center provides medical care, occupational training, and counseling. This type of social co-op combines skills training with social care.
The interest of every worker to maintain high quality. This is, for me, the main theory about competition between social cooperatives and the private sector. Mainly the workers of the social cooperatives are educators. They come from the educational field. They don't come from the managing field. This could be a problem for us if you compare social cooperatives with the private sector, because we use a lot of time in educational activities. For example, if you have to build this box just in a normal wood laboratory, you just look at this box. You don't waste time in taking care of personal problems. And we still have to find a sort of balance between paying our attention to social problems and to the economical result. So this could be an handicap for us. Now it's finished creating services just because the public bodies have ideas and resources. Now there are no more resources. So if you want to ask the families and the citizens resources, we have to create services they want, not just one service for everybody. We have to create different services, even in the same town. Probably in this quarter they need services for handicap. On the seaside they need different services for families coming during the holidays. So this sort of universality of services is not working now. This was the original idea. And we, as being enterprises, social enterprises, we have to diversificate our clients. We can't keep having just one client, the public bodies, because they are little by little retiring. They asked us to create new services with them, but not only with them, with the families and the productive forces of this territory, but asking directly them what they want.
Now, why then a cooperative firm has an advantage? Just because a cooperative, not being a profit-maximizing firm, has no interest, so to speak, to exploit and to cheat the person. That is not the case with the capitalistic firms. A capitalistic firm, in order to maximize, can, for instance, in order to reduce the cost of provision of a certain service, is always liable to cheat, where cheating means not offering the best type of service. So this is the first advantage. The second advantage has to do with the consideration that in the social services, consider, for instance, education, health, assistance, etc., etc., it is obvious that the possibility of making profits is not always guaranteed. So if I am a profit maximizer and I perceive that in that particular sector there is no room or no scope to do good business, I will never enter that sector. The very moment the firm perceives that the profit goes to zero, the firm will disappear, irrespective of the needs of the population waiting for that particular service.
Noi crediamo che nel futuro avremo sempre più una funzione politica.
We believe that in the future we will have an increasingly political function, a function of vigilance over the state and the bureaucracy. We will ensure that the state will not back off from its responsibilities, because if everything is left to economic liberalism, to free enterprise, to competition, and as we fear it will, we will have a society which will create disparity and inequality. Today, it is still possible to create societies and enterprises that are democratically controlled and support the interests of their users and their workers. This is a very important challenge we are facing, yet it is a challenge we will live up to.
New York City is about as far removed from the social sensibilities of northern Italy as one is likely to find. And yet here in the South Bronx, the co-op model has been adapted to serve some of the most vulnerable people in this tough city neighborhood.
I've never worked for anybody but cooperative. As a matter of fact, I don't tell people my personal business, but before I started working for cooperative, I was on welfare for a great many number of years. And this enabled me to be
self-sufficient.
Yes, and to provide some of the things for my children that I was otherwise dependent on a little check that wasn't going to be good until the next day, and I owed this person, and they gave me a chance, you know, and I just was ready. It was just my time. I also joined. It took me a while to feel them out, and because, you know, we're worker owners. And I was, I'm not going to invest my own, crazy. But eventually I did it. And it's been just wonderful. It's nice. And just to say, you know, I own a part of something. I'm a part of a bigger picture, you know. It's nice. It's a wonderful feeling.
Cooperative Home Care, good afternoon.
Cooperative Home Care Associates was established as an employment program for welfare recipients and now has 600 worker members whose parenting skills are put to work helping those who can't help themselves.
The original motivation for starting cooperative home care was an economic development strategy. It's primarily a way to create good jobs in low-income communities, to provide easier access for workers to better jobs, and to structure the company in a way that would ensure those good jobs would stay within those communities. The co-op model was selected for a number of reasons. The first was that it allowed workers to fully participate in the design of their work, in the development and the running of the company. It ensured that our caregivers, our paraprofessional aides, stayed central to what the business was. But primarily as a legal structure, we structured it as a cooperative because we, as the founders, knew that if we left, we could certainly ensure that it would stay a worker cooperative, even if none of us were there 15 years, 20 years hence.
I came to CHCA one day. I came in, I got the interview. I love working with people, so I said, this is the job for me. I did the training. I did my 4 weeks. I was really, really happy to be here, knowing that after the 4 weeks I was gonna have a job. That was the best thing. I says, well, this is it. I'm really working now for my own. I don't have to go out there, because sometimes you would try your best in these places and they would humiliate you and make you feel downgraded. But my life has changed tremendously ever since I've been at CHCA.
Being an owner, it makes you feel a sense of warmth, and a company that makes you feel like you're somebody. So it helps. It helps to want to change and to do the best you can, to do the best job you can.
Mm-hmm. The particular advantages of the cooperative in a low-wage sector like daycare or healthcare cooperatives is that it allows us to maximize wages and benefits for our workers, because obviously our shareholders are our workers. It also, if we're able to expand, it also will allow for us to advocate for changes in policies that reimburse healthcare and daycare, and to also advocate for regulatory changes or industry changes if we are successful in expanding the number of daycare or healthcare co-ops. And that is primarily, it's a service in terms of the human service side of the work that we're doing.
David, I'll see you tomorrow.
Okay, take care.
Bye, Lucky. That's not what I do every night.
It's all right. It's all right.
It's not only on the hard streets of the Bronx where the idea of social co-ops has made a difference. In the heartland of conservative Ontario, Kingston is creating new solutions to the problems of social exclusion faced by people with developmental disabilities. The Kingston Association for Community Living has been a leader in the training and employment of these people.
We considered the co-op model basically because in the early 90s, we as an association, through a study that we did of members and participants, decided that we had to do something very different with the workshop, whether that was close it or to look at developing a model that better served the folks that we supported. The model has had on the work itself or the productivity of the people. And I'll give you an example of that. When we were in the workshop, we had 55 people. We had 5 or 6 vocational staff. And our work comes in measurable tubs of work. We were able to produce 25 tubs a day on an average. We now have, on a daily basis, about 30 disabled owners. We have 4 managers, and once in a while we have a couple of casual people come in, and we produce between 50 and 60 of those tubs a day, every day. So our productivity has more than doubled on a regular basis. And if you look at the actual number of people participating in the work that we're doing, it's far more than doubled, and we've been able to maintain that.
Other jobs that I had, that sometimes it would last, and it was on different contract basis that I was there, allowed to be there, or just sometimes I'd be there for maybe a good 3 or 4 years, and then they didn't need me anymore. But with this job here, it gives me good feeling to get up in the morning just to get to work and just to be here at this place. The atmosphere is just tremendous. I really enjoyed my working. We are our own boss, and we own the company, and we also hire some staff to help us out.
Once people start making decisions, they continually want to make more decisions and want to participate at a greater level than they ever have before. And that even after 6 years, we constantly see that people take for granted now that decisions are going to be made by them and not for them.
And what I like very much about cooperative is that it empowers people. If you simply work with government programs or even with nonprofit organizations, you don't see those type of action building power in people. Cooperatives do essentially that.
And I was feeling downgraded and different. My life was different, but it has made a big change. And I think that being here at CHCA has made that difference in me. And there was so much in me that I didn't know I had.
The sense of empowerment that cooperatives offer to people can be profound. Whether it's women struggling for economic independence or addicts seeking freedom from a life of drug dependence, social co-ops have the potential to revolutionize social care as we know it.
Thank you for everything.
San Patrignano give me one thing very, very important. He gave me a chance when no one else gave me a possibility to end my problems. Sempetrignano gave me his hand when I've been in a jail, and no one else wants to help me. It's been the first step, but the most important step in my life.